Welcome to the Health Equity Exchange. I'm Maynard Scales here at Hot 91 WNSB and also WNSB's The Rebirth Pool radio station. And the Health Equity Exchange is an opportunity for the radio station, along with, in fact, driven by our partner, the Virginia Department of Health, in an effort to make certain that people in the community learn more about ways they can have better public health outcomes and learn more about how they can take advantage of opportunities that exist here in the state of Virginia and particularly right here in your backyard in Norfolk. You know, the person who's really spearheading this, the person who's like pushing me and cajoling me and making me be certain that we talk about these very important and critical issues is with me today. Her name is Miss Jasmine Garcia. Hello, Jasmine. How are you?
Good morning. I am well. How are you today?
Excellent, excellent, excellent. So we really are seeing quite a deal of challenge, not only in Hampton Roads or Norfolk in particular, but across the country where opioids have kind of taken hold of communities. There are some things like, listen, we would love to wave a magic wand and no one have problems with opioids and those things that we know as like Oxycontin, Codone, or what have you, all the way up to things that are typically more illegal drugs like heroin. They have some of the same scientific properties, so therefore people abuse them similarly. We want to wave a magic wand and make that go away. Those things can't just happen with a snap of a finger. Tell me a little bit about what things we should expect and can expect as a means to make progress against, something that's just unfortunate.
Sure. So something that I would say that we could do, because of course we wish that there was a magic wand that could eliminate and eradicate all substance use, mental illness, all of those disorders that are really impacting our communities today in all ages. Let me make that very clear. It's impacting every demographic, every age. Something that we could start doing, and something that's been mentioned often, is just destigmatizing our communities, destigmatizing what mental illness looks like, destigmatizing substance use disorders in general. And it starts with conversations like this. If we're open to having conversations and open to education, I believe that a lot of families and a lot of people that are struggling and impacted by opioid disorder, opioid use, substance use disorders, and more specifically, the overdose deaths that we're seeing in our city and in our community would rapidly decrease. Mm-hmm. If we had more conversations like this, more safe spaces for people to have these conversations and just learn about what that does, how it impacts our communities, how it's impacting our younger youth, we would definitely be in a much better direction.
So, I'm really excited that you mentioned two things here. One is the stigma piece, and the other thing is the outcome of use, what could occur. And I'm really excited to talk about this because, I grew up through the 80s, just outside of Philadelphia during what was called the crack epidemic. And the stigma of this, now this obviously is not opioids. Crack is cocaine is a different drug. But the idea that somebody was labeled a crackhead or a crack baby, and it made it embarrassing and shameful, etc. And that is a barrier to getting support and health. In addition to that, I guess if we think about it, in the 70s, we would call people who used heroin junkies. Mm-hmm. And so that stigma makes it really difficult for our community to have the kind of compassion necessary, as well as it created this, which was a barrier, and then it created additional barriers because it really castigated people into these, almost villainous, monstrous, less than human kinds of personalities, if you were, personas. That's one. The other part is you discussed that there is the potential for overdose, which could lead to, unfortunate health outcomes leading up to and including death. So can you talk a little bit about, let's just for a moment talk about how do we combat the first barrier, which is the stigmatization?
when you talk about stigma and you talk about the history of things, you also can look at families and how some of our culture, some of our upbringing kind of led us to, one, not wanting to receive help, or two, being fearful of receiving help. And I truly believe that if we had conversations within our families to kind of destigmatize what that looks like, we would definitely be in a better direction. And what I mean by that is, so in my own family, there was never a mental illness. There was just junkies or somebody who was using drugs. There was never any talk about mental illness, mental health disorders, or anything like that. And so for us, it was just someone that was using drugs just because. When realistically, a lot of the family members that were using substances had either an undiagnosed mental health disorder or an untreated mental health disorder. So some were diagnosed and then they were self-medicating at that point. And it really takes knowing the root of a family and a root of the why people are doing what they're doing, and I guess getting the assistance that you may need in the treatment. And I really think that it takes an advocate to do that, whether it's someone from your family, someone from your community, just another voice that can assist you along that path. So someone may not be ready for treatment, but they may be open to listening to what other outcomes there are for a positive health outcome, so that you're not experiencing overdose death or loss in the family, and what that dynamic can continue to look like incarceration, like DCF getting involved, like family members not talking to each other. There's just so many negative dynamics that creates, that if there were a positive voice, we would probably see it. We would probably be in a different space right now. As
you kind of mentioned that there are these undiagnosed and or untreated or whatever mental health conditions, one of the other things that really sticks out to me is that often these mental health conditions are because of some trauma or occurrence that may have occurred, that may exist. For instance, as you share some of your own personal story, I had family members who had similar issues, or people I in fact grew up with or what have you, and I was unaware, or the family had largely been unaware that the niece, the daughter, and the mother's boyfriend had been involved in, a sexually abusive relationship, and therefore that drove her to have this thing. And so it's a lot to uncover. That's just one example. Other examples may include people who feel have essentially middle child syndrome, where they're kind of expected to do a lot of things and expected to be the support block for a lot of things, while the older child kind of gets a pass on things, and the younger children depend on this person or what have you. Or, I think even where some people deal with, younger people deal with parents divorcing. And those kinds of traumas can be triggers that, I don't know if those are necessarily mental health issues, but those are certainly triggers that can lead someone into feeling like they need some additional use of a substance or what have you to make it through. When people are experiencing those kinds of things, short of being involved with, the intervention at the drug level, are there services that are available for people who are experiencing different trauma or mental health issues that are available through your organization?
Yes. So specifically with the Norfolk Public Health Department, we have a couple of things. So we have a new system called Credible Mind, and if you visit norfolkpublichealth.com, you can access that resource. There are also many other resources that are provided and shared on there, whether it be the suicide crisis line for 988, as well as local resources, so the Community Services Board and various grassroots organizations that are currently working towards those specific outcomes.
So let me just make sure I jump in here. It starts, the simplest, easiest way for any of this to start is by somebody visiting like norfolkpublichealth.com. If they can go, if you start there, you may not find the exact right answer there, but it's a start. And it's kind of like, pulling the thread in the sweater, right? Like, we may never get to where we're trying to go just by going here, but it can lead us to the right resources that are available through the Norfolk Public Health System.
Absolutely. And there's also, on our website, there are a lot of access to resources that provide self-help, whether that be a group. It could be, we have NA and AA resources in the city, but specifically for self-help, there are a lot of organizations that offer at that level before the clinical intervention. And
So, a moment ago, you kind of mentioned a little bit about your personal journey, and then there have been events that we've attempted to partner on, and we'll be partnering with one another in the future. For instance, the Save a Life Day at NSU. And then there was also an event at MacArthur Center Mall. So let's talk a little bit about what these events do, what are some of the components of those events, and how people can get involved.
Sure. So specifically for Save a Life Day, it was our first time as an organizer in the city, and I had just started in this role in January. So it was something that I really, really focused on organizing and coordinating at a collaborative level with 4 local universities, and that included Norfolk State University, Old Dominion University, Tidewater Community College, and the
was it on the other opposite
Yes,
Is it
I can't
Hampton?
think of it right now. No, it was actually in here. Sorry.
Okay. It doesn't. It doesn't matter. Right? The only one that really needs to get a grade here is Norfolk State, so we're fine. So you had this. It was an aggressive first jump out, right? And I'm certain that there were some bumps and some bruises. But if I were to go to that event, what would I learn?
Sure. So specifically at Save a Life Day, our goal was to put naloxone in the hands of everyone. And what has been missed within the city of Norfolk has been the college age. And what was identified was that the ages of 18 to 34 was the age range. And that's a big age range and group. But those were specifically the groups that were overdosing, that were identified via a couple of statistics and data that we've gathered. And it was very much a strategic plan to make sure that we identified those at that level, those groups. And so what we were able to do was we provided revive training, and it was rapid revive. So what that is we're providing and sharing the overdose methods of the education on overdose reversal. And in providing the overdose reversal education, we also provided nasal naloxone, which is the overdose medication to reverse an overdose. Okay,
so nasal naloxone.
Yes.
And naloxone is spelled Naloxone. This is a drug that is squirted into the nasal passages, and it helps to very quickly and rapidly help people, revive from a potential overdose, which could lead to not only failure of organs or, kind of stroke-like activity in the brain, but also could lead to death. So this drug has been used for a bunch of years now, and it's been a wonder drug, if you will, and not to say that this should be abused or that someone should just carry this just because, hey, I plan on overdosing today. I think I'll just, but in the right hands and for the right reasons, it could help save a life.
Absolutely. And that was definitely the goal, to ensure that everyone had that tool, because there's no use if you don't have it on you or available. Mm-hmm. And what way to save a life than have the education and know what's next, and being a part of saving that person's life and what that would look like for them and their family if it were a different outcome.
Now, a handful of years ago, this also, or maybe it's a different drug, but there were Narcan and things of that nature. So people may be more familiar with other brand names, if you will, but they ultimately are, have the same outcome or the same intent and use.
oftentimes people see harm reduction as, well, we're just encouraging substance use, or we're just encouraging someone to continue use. However, there's a safe way to do certain things, and that's how we're trying to identify and educate others that there's a level of harm reduction that helps to save a life over not providing these interventions, and we have massive, amounts of deaths due to substance use and mental health disorders. So in that, we're collaborating with other local organizations to increase harm reduction measures and methods in really saving lives of our Norfolk residents.
So, we've discussed a lot about what services are available. We discussed a lot about what this drug will do, but people may not know the size of the problem. And as we, when we sat down for our first kind of conversation and we saw what some of the numbers look like, particularly where other problems exist. And at some point in the future, these conversations through Health Equity will discuss things like other outcome issues, like STDs, etc. We were finding through the research that there were significant challenges with overdose. Can you share with me a little bit about what that looks like in Norfolk, in Hampton Roads, and then how does that position us kind of in the region or the state?
Sure. So one positive in this is that the opioid epidemic and the opioid death numbers are decreasing. So that's a plus. And what we are identifying is that there are more organizations, more people who are being equipped with the Revive education and nasal naloxone. But when we look at the actual deaths, it's impacting every community, every zip code. It doesn't have a face, a name, or a specific look. It's impacting everyone. And something that we're really trying to ensure that people understand is that it's impacting our middle school age youth and our high school age youth, and we need to help save them. We need to help educate. We need to help educate their families and just educate the community so that we can continue on a positive trend and really decrease those death outcomes at this time.
So if we can help do that, a handful of things that becomes apparent that we have to do. One, we need to try to identify in the communities that this is occurring. Two, we need to break down the stereotypes and all those additional barriers of stigma that exist. Three, we need to get the education into the hands of individuals. And then four, get the education and get the resources there. So, but one of the things that we didn't discuss is number one, how do we identify what it looks like? Somebody, for instance, a different substance, alcohol, somebody comes to work every day and no one really knows that this person is dealing with challenges, et cetera. And we almost kind of laugh like, oh, you got a little hangover. Oh, ha, ha, ha. How do we know when someone is dealing with a real problem and not laugh it off or sweep it under the rug?
You're going to be able to identify certain things when a person is changing, but first you have to be open to what that looks like. So you may have to have some training or background in understanding what substance misuse looks like or mental illness looks like. And in that, it's kind of like what we did at the mental health movie screening at MacArthur Center. There was a lot of conversations around what mental illness is doing to our youth, what mental illness is doing to our community, and the self-medication piece. And with us being present and visible, we're able to kind of help break those stigmas down. And for someone in the workplace, I feel that it takes a collaborative effort where, say, Norfolk State is like, hey, Norfolk Health Department, how can we get some education on this? How can we really learn the signs and symptoms of this without being judgmental? Without brushing it off, without laughing it off, because this is a serious matter. We're talking about lives every day, and not just the life of that one individual, the lives of their families, and how that is impacting our communities and how it's impacting our world. And I think that it just takes for an individual to want to understand and not judge what that looks like and how they can be of help and not hinder.
So now we know so a handful of things that we should have learned by now in this particular conversation. We need to be able to identify when people are experiencing issues. They're changing. There may be behaviors that they exhibit today that they didn't before. Agitation, maybe some signs of depression, withdrawal from certain things, etc. And there's probably in literature that we can find all the telltale signs that someone is having difficulty from their persona standpoint. There are also some physical things, obviously, loss of weight, what people call often a junkie nod, etc., and sickness. Then I think there are some things that we know from, unfortunately, the stereotypes. Poor management of money. I need $10. I need $20. I need it right now, etc. Then we need to move on. That now that we've identified that, we know that there are some places where these help can exist. NorfolkPublicHealth.com is a great place to start. If you're experiencing this problem, or if your family member or a loved one or a coworker is experiencing a problem, this is a great first place to start. This third thing is there are the resources that exist there. For instance, the use of and or at least education of this nasal naloxone drug that helps for the rapid revival of someone. And then lastly, obviously, which is a portion of harm reduction, that we have had some significant impact on harm reduction in the area. As you said, the numbers are going down. So, but why do we do this? As a community, at some point, man, it's just a drag on our taxpayers and everything else that people are involved with drugs. Let's just, push them over to an island somewhere, gather them all up and let them just do whatever they want to do. And, it's easier to deal with that. But the Virginia Department of Health and the Norfolk Health Department see a more important way to deal with this. And which kind of goes to the role of the health department in the stewardship of community health. Tell me a little bit about that. Absolutely.
So in what you shared, the key thing is to remember that a person is a person, and they have a heart. And we have a heart, and we really need to value what a life is. And the way that we are stepping in is to identify what that looks like. So 1, the signs and symptoms, 2, what supports are out there, and then 3, the collaborative efforts that we can all come together and put out. And I believe that if people understood that it's someone's mom, it's somebody's neighbor, it's somebody's coworker, once they identify that it's a person and who they are, once we can share those stories openly and willingly, there will be more help and more support, rather than go, to an island and let them do what they want to do, because that conversation will come up. Why don't you just let them fail? They're already doing these things, but there's a lot of interventions, and something that we often talk about is Norfolk being resource rich. But again, who is that person that's kind of grouping everything together? Who is the hub? And I believe that the Norfolk Health Department wants to be that person. We want to ensure that we are not the central, but that we have the resources and the collaborative efforts to ensure that those resources and the people that are struggling have access to them. So for anyone who's listening or seeing this on YouTube or whatever the case may be, if you are concerned that you or a family member, a loved one, a coworker, a personal friend
may fall through the cracks, may find themselves having a difficult time finding service, or at least combating the use of drugs. They want to make a change in their life. They can start by going to norfolkpublichealth.com. NorfolkPublicHealth.com is a resource that at the very least will introduce, as you said a moment ago, people to some ideas and help them become open to listening. And maybe today's not the day that you make the change, but this, sometimes just like anything else, we have to plant a seed. I want to thank you, for sharing today. I think this is critical and important. I think we're going to have a really great series of conversations regarding the public health in places like Norfolk, which is, I consider, the urban center of Hampton Roads. Unfortunately, the urban centers of any community are also the trafficking of all the things that are typically bad in the community. We have the transit system that allows people to kind of come and go from city to city, state to state. We have the airlines, we have the bus systems, et cetera, et cetera. And for whatever reasons, these are the places where some of these challenges exist. And so I'm really excited that we're making our first efforts here to help Norfolk and the whole Hampton Roads region be a more resilient community.
Absolutely. So we currently have an addiction campaign that is running on the radio and on TV and some billboards.
Let's take a listen to that radio spot now.
Welcome to the trash. Heroin get you in here too?
Pills. It was quick. I went from standing in line at the pharmacy to hurting the people I love. Whatever it took to get more. I don't blame anyone for being done with me.
Well, this is us.
Don't throw away hope. Addiction is a treatable disease. Visit NorfolkPublicHealth.com to learn how you can help someone struggling with addiction, even if that person is you.
That's pretty compelling stuff.
Once people hear that and watch what that is doing, it'll definitely pull at your heartstrings and it'll open up that conversation, and then it'll lead you to, reaching out and visiting the NorfolkPublicHealth.com website for more resources. And you mentioned resilience, and I would like to just put in a little plug there. So on top of being the health equity specialist, I am also the founder and president of a local nonprofit called Gear Recovery. And with that, our mission is giving everyone an advantage towards resilient recovery. And we provide guidance, education, advocacy, and resources to children and families who are experiencing or struggling with substance use and mental illness. And in that, we offer after-school programs to our youth to show them a different way, and it's called The Way, and offering them with various organizations to come in and share presentations. Health department comes in and offers health education to them, healthy hand washing, healthy eating habits, all of the things that our youth and our children are experiencing. I just like to go back to the collaborative piece. It would not be possible to get where we were if we didn't have the collaborative efforts of the Norfolk Department of Public Health and various other organizations. But I think for us, like one of our strategic things was we wanted to go in a role of clinical, and instead we decided to go peer. What I mean by that is what's happening right now is there are a lot of clinical interventions, but some people are not ready to get there. So you really need somebody who can listen and offer that helping hand to get to that step, if that's ever in their, in their path to recovery. But in that resilience piece, offering a peer, and we have youth peers, and then we have some older adults as well that are peers, providing those resources. And it's just really important to have that as a resource in our community, because it's something that was not provided to myself or my family growing up, dealing with and experiencing a mother who struggles with mental illness and substance use disorders, who is up and down and relapsing and in her recovery journey. And I think it's just really important to know that there's so many of us that have a story to tell. We just are not being provided those spaces to tell that story. And when you're offering a safe space just like this and having these conversations and this equity exchange, it's offering that next step of this is healing for me, and could be healing to somebody else in the room or who's listening on the radio. And I'm grateful for the opportunity to be able to share that piece. But it's such a passion for me in the health equity role to not only provide the access, but to be that advocate and share how we can all live healthier lives. But how can we get there, and who do we need in our corner to get there?
That's excellent information. And I want to make sure, because I'm not the smartest person in the world, for sure. And you said there's a clinical approach and there's a peer approach, which sounds like clinical sounds a little bit more high level, where peer sounds very much more granular and kind of person to person. And so I think as people kind of parse that and understand, there's a big system that does exist that can be very helpful. And you shouldn't fear being chewed up by this bigger system. As a result, before we get you into the bigger system, if you need, we can ease you in through a peer intervention, so to speak. And therefore, you can have a little bit more personal one-to-one help before you start to enter into the larger system that's there for you. That's a really great, I hope does that explain it?
It actually does, because
I got one right today. I got one right.
It does.
Now, with your personal organization, how do people find out more about that?
So you can go to gearrecovery.org for more information. We're also on Facebook and Instagram at Gear Recovery Inc. and find more information on there, how to volunteer with us, how to join us and be a facilitator for our after-school programs, how to partner with us, how to, assist our youth. And we're always looking for collaboration.
Excellent, excellent. So again, I want to thank you. I want to appreciate everything that you're doing in the community. GearRecovery.org if you would like to find out more information about them, and NorfolkPublicHealth.com if you are experiencing challenges or someone you know is experiencing challenges. These are both great places to start. We'll do this again. Continue to listen. We'll be here next week. We're Hot 91, the Solar VA. Thank you.